CSF explained like never before. So we are going to discuss. Have you ever wondered why our brain doesn't collapse under its own weight? Why doctor insert a needle in the lower back during meningitis, or how a tiny change in one clear fluid can tell us if someone has tuberculosis, cancer, or brain infection? The magical fluid is called cerebrospinal fluid, that's CSF. And today, in the next 30 minutes, I will make you understand CSF so clearly that you will never forget it for exams, viva, or clinical practice. Let's begin. So, what is CSF? So, cerebrospinal fluid is a clear, colorless fluid that surrounds the brain's spinal cord. It acts like a protective cushion. Think of it like a brain floating inside a water balloon. Without CSF, brain would hit skull during even a small movements. Where is CSF present? CSF, cerebrospinal fluid is present in ventricles of brain, subarachnoid space, and central canal of spinal cord. The ventricles are two lateral ventricles, third ventricle, and fourth ventricle. Now, formation of CSF. So, CSF is formed by choroid plexus. That choroid plexus is located in the ventricles. So location in ventricles. So it is formed from blood plasma. How much kitna formed hota hai per day? So about 500 ml per day, we can say for 500 ml per day, but total CSF present at one time is only 150 ml, we can say. This means it is continuously formed and observed. Circulation of CSF, so very important for exam flow पूछ लिया जाता है तो mainly left ventricle से third ventricle and then fourth ventricle, there is subarachnoid space and then spinal cord. Absorbed in blood by arachnoid villi. Absorption occur in superior sagittal sinus. If the circulation blocks, it will lead to hydrocephalus. Now composition of CSF. So what is the composition of CSF? So normally it's contain water, 99% glucose, protein, electrolytes, very few cells. Normal value, mainly parameters we are having, pressure is 75 to 200 mm H2O. Now protein we are having 15 to 45 mg per dl. Glucose we are having 45 to 80 mg per dl. Cells we are having 0 to 5 lymphocyte. So you can write these in your exam. Now let's see the function of CSF. So function of CSF, so it acts like a cushioning, shock absorption करता है, न्यूट्रिशन सप्लाई में हेल्प करता है, वेस्ट रिमूवल में, और मेंटेन करता है इंट्राक्रेनियल प्रेशर. इंपॉर्टेंट फंक्शन इसका क्या है? ये रिड्यूस करता है इफेक्टिव वेट ऑफ द ब्रेन फ्रॉम 14,000 ग्राम टू अबाउट 15 ग्राम. सो लंबर पंचर. सो व्हाई डू डॉक्टर इंसर्ट अ निडल इन द लोअर बैक टू कलेक्ट CSF? तो CSF कलेक्ट करने के लिए वी हैव टू डू लंबर पंचर. सो वेयर इट इज डन, you can comment down and I'm telling you the answer, but guess where it is done. So yeah, it is done in L3 and L4, or we can say L4 to L5. So why lower back? Because spinal cord end hota hai L1 and L2 pe. Used in diagnosis of meningitis, encephalopathy, multiple sclerosis, and subarachnoid hemorrhage, CSF in disease. So we are having bacterial meningitis, viral meningitis, tuberculosis meningitis, and subarachnoid hemorrhage. So we are starting with the CSF in disease like bacterial meningitis में प्रोटीन इंक्रीज रहेगा, ग्लूकोज डिक्रीज रहेगा, न्यूट्रोफिल्स इंक्रीज रहेगा, एंड टर्बिड CSF विल बी देयर. नाउ वायरल मेनिंजाइटिस में वी आर हैविंग नॉर्मल ग्लूकोज नॉर्मल रहेगा, एंड माइल्ड इंक्रीज इन प्रोटीन विल बी देयर एंड इंक्रीज लिम्फोसाइट विल बी देयर. ट्यूबरक्लोसिस मेनिंजाइटिस में वी आर हैविंग वेरी हाई प्रोटीन एंड वेरी लो ग्लूकोज, lymphocytes will be there. Subarachnoid hemorrhage, mainly only blood in CSF. So it is very important for viva. They are CSF diseases, so we can tell bacterial meningitis, viral meningitis, tuberculosis meningitis, and subarachnoid hemorrhage. Now we are having hydrocephalus. So when CSF accumulates excessively, so mainly it is of two types, communicating and non-communicating. So in baby, head enlargement is seen, and in adults, headache, vomiting will be seen. So treatment इसका shunt surgery होता है. So now रैपिड वाइवा क्वेश्चन विच आर आस्क्ड. सो मेनली आस्क कर दिया जाता है नॉर्मल वैल्यू ऑफ CSF विच आई टोल्ड, वेयर इज CSF फॉर्म विच आई टोल्ड, नॉर्मल प्रोटीन वैल्यू, एंड वेयर इज लंबर पंचर डन, what happens in hydrocephalus, why glucose decrease in bacterial meningitis. You have to comment this and down the answer. So after this we are having CSF may look like a simple water, but it protects your brain, tells doctor about deadly infections, and silently maintains life every second. So next time you hear lumbar puncture, you won't panic if you understand it. if this is helpful for your exam or clinical practices, so comment CSF mastered and tell me which topic you would like I should break down the next. And I'm not making the lecture too long, as I told, I have concluded all the points in very precise way so that you can understand it very clearly. So only important points are covered and nothing is left, like कोई भी point इसमें छूटा नहीं है. I have covered with all, so I think now you won't be forgetting CSF your whole lifetime. So with that, if you found the lecture helpful, do like, share and subscribe the Just Nursing Things and follow for more.